Jay Wilkinson is going to be joining us today to present on motivational interviewing for adolescents. So everybody welcome Jay.
Thank you, Cassie. This is going to be motivational interviewing for adolescents, substance use disorder. And let me just move forward here. I'm going to kind of pause throughout at certain points for questions. And if there are no questions at that point, I'll just kind of keep going. And then definitely at the end, there's a time when I can have questions as well. And looking forward to that. I have no financial relationships to disclose. It says only my genius. That's like a Oscar Wilde joke, because it's like, what do you have to declare? Only like in a customs thing. He said, only my genius. I keep trying to make that joke work, but it never works. The customs people never think it's funny. Okay. So our agenda is going to talk about motivational interviewing, including like the key principles of it. And I'm going to get a little bit more into the details of how motivational interviewing works. And not just the kind of broad overview of what it is, but actually kind of get into some of the techniques, and hopefully that'll illustrate for you all why and how it's helpful for adolescents in particular, and also for substance use. So like it says, why it's a good fit for that, and then how it can be effective with adolescents in particular. And one thing to know about motivational interviewing is that it was developed originally back in the 80s for patients with substance use disorders. So motivational interviewing has in its DNA that it is developed for use with substance use disorders. And then since then, it's moved beyond, like it says, to different public health, medical. There's a very widely utilized like motivational interviewing in a in healthcare settings book. Criminal justice, education, sports, parenting, and because it's just a widely, broadly applicable set of skills. But I like that, and that's why it makes it particularly pertinent for our discussions today, because it was originally for substance use disorders, and then it was developed kind of alongside the stages of change model, which for those of you who work in addictions and substance use, you'll be very familiar with that. I do have a slide on that, so I'll just talk briefly about the stages of change model, but I'm not going to focus on that very much because it's probably very familiar for a lot of you. But it's interesting that there's ways that motivational interviewing and the stages of change model kind of overlap with each other. All right. So, all right. So what does it look like in practice? So motivational interviewing, there's different stages to it, which I'll talk about more in depth, but it utilizes kind of the Socratic approach in terms of open-ended questions and reflections, reflective listening, and a conversation with a young person. Throughout this presentation, I'll be using, of course, young people, youth, and teens, adolescents as the examples. But about behavior change and like what. And so whether, it comes from the perspective of like the person you're talking to either fully wants to maintain the status quo of like the behavior that they're doing, like, so in this case, substance use or other unhealthy behaviors, or they're ambivalent about it. That kind of, and so motivational interviewing meets the person where they're at in trying to move them forward, I guess, in the stages of change, or move them towards a space mentally and emotionally where they're they're receptive to change. And so again, open-ended questions, reflective listening, paraphrasing, summarizing what they've said, and then it really takes a step back from offering advice or information without kind of doing some pre-steps, including, importantly, getting permission from the person, in this case, the youth, the adolescent, for that it's okay to give feedback to them. Teenagers, young people, one of the most important things in their lives is to the developmental place that they're at is individuation, individuation from their family of origin, and so as they are emerging into becoming an individual, and they also are in that phase of really wanting to push back against control, to not feel controlled by others, but rather to seek out a sense of control over their own lives. And sometimes that leads them to make unhealthy, harmful choices but just knowing that as like the backdrop, that they're seeking this sense of control over their lives, aligns with motivational interviewing, because it focuses on giving them that sense of control in the interactions. And also, like psychological reactance is a term that's used sometimes, like just being like, well, if you're wanting me to do this, then I'm just going to do the other thing, then like just kind of being defiant, as a way of asserting individuality and asserting control over the situation. And so motivational interviewing really seeks to not play into that, but not to get into that power struggle of like, well, you need to do this. And so, you want me to do that? Well, then watch me do the exact opposite of what you want me to do. So it really tries to sidestep that power struggle and instead empower the youth through the interaction. And we'll talk more about what that looks like. As young people, adolescents are still forming their values and goals, unlike adults in the sense of or some adults where they kind of already know what's important to them. They know what their goals are. They know, they're still forming those things. And so that presents an opportunity to meet them where they're at, of like, what's important to you? How might this behavior be conflicting with other life goals that you have, or maybe not goals, but values? I'll just take a really quick sidestep to say that another form of therapy is acceptance and commitment therapy, ACT. And one of the things that I learned in studying that is they had a really good formulation for the difference between values and goals. They said that if imagine you're traveling north, and north is a value, you never get north, you never arrive at a place that's north, it's just an idea, it's a principle that you're following. That's the value, versus a goal would just be an actual place along the way. I'm going north, I'm going to Seattle, I'm going to Vancouver, BC. And so that, I just liked that formulation. Sometimes when people talk about values and goals, they sort of use those terms interchangeably, but I think that is a nice way to differentiate those two ideas, especially in helping young people to form those things. And then let's see. So, it encourages direct communication, and it really focuses on relationship building as a pre-step, rapport building, relationship building, to kind of making the more directive elements of motivational interviewing. So let's see here. Okay, and the interventions can be brief and incorporated into primary care visits. That's definitely true. Okay, so then this is saying what the alternative or what traditional models of motivational strategies are. And so traditional models are guided by assumptions that youth, or just people in general, are ignorant or in denial about their unhealthy behavior. I mean, ignorant is a strong word, but it's essentially people don't know. The idea, if you just give them the information, then they'll know that that's bad and unhealthy. And we know from a lot of studies that that's not true. And people, if you give them factual information about things, then that can be a part of changing someone's mind. It can be a component of it, but that alone, rarely changes anyone's behavior. And then also, or that they're in denial, they don't understand, or they don't accept it. When a lot of young people are ambivalent, they understand some of the harmful effects of their substance use, but they, it's complicated. They don't necessarily see an alternative that would work for them. And so they talk about the writing reflex, that term is you want to set things right, you want to warn, prevent, course correct for the person, and it's a really it comes from a very, wanting to help place, and it can be like, wait, like it can be that like reflex, like this, it's kind of like our first instinct, our first reflex to like, come to the person with this like direct health coaching mindset of like, no, don't do that. Like that's not healthy for you. And it's and again, like some young people who are in a change phase of their stages of change, like that could be okay. It's not to say that that's always the wrong approach, or direct health coaching is like never, is never good. It can be. It's just that the person has to be in the right stage of change, and the right place, and their ambivalence about change has to be kind of like almost resolved. They have to be kind of almost ready to make changes for that direct health coaching straight ahead to happen, to be effective. And so it could be a no nonsense, or a gentle tone. I was thinking about like Dr. Phil, like get your life together, like pull your head out of the sand. That's like obviously like the more no nonsense, hard, tough love approach, or it could be a very gentle tone. It's just, but it's the same thing of that kind of like straight ahead, health coaching, just letting them know this is what's wrong. This is what you should do differently. And also that misunderstands, especially for youth, so like, I feel like that straightforward approach could be maybe more generally effective, for adults, still not very effective in a lot of cases, but for young people in particular, because they're in this phase of individuation, because they're wanting to assert control over their own lives, then it's particularly not helpful for them to voice, to get into that power struggle of like, this is what you need to do, this is what's healthy, and then it almost like reflexively then makes them flip the coin and say like, no, I'm not going to do that. I'm not going to be under your control. And another thing that's interesting, this comes from like cognitive psychology, is like we tend to believe what we hear ourselves say. It's like we believe ourselves. Like, so if we hear ourselves expressing thoughts and ideas and beliefs, it's like it entrenches us more in those thoughts and beliefs. And because it's like we believe ourselves. we feel like ourselves have a high degree of believability, of like, and so one of the approaches is to take the time to figure out, to focus on their reasons for change, which could be different from society's reasons for why they should change, and why they should curb their substance use in this case, or other behaviors. And so taking that time to learn from them, what are their reasons, what are their values, can be really important. And then ultimately it's getting to having them being the ones voicing the reasons for change, voicing the arguments for why they need to employ a healthier behavior, why they need to change their approach, why they need to move away from their substance use. And so it gets to what, in a way, is kind of the goal of, the goal of motivational interviewing is the behavior change, is the changes that need to be made in the person's behavior. But in terms of like, how does that look? It would be eliciting change talk. So change talk is like, and I'll talk more about that later on, but it's like hearing them, instead of them being the ones arguing why they can't change and why that's not going to work for them and they need to just maintain the status quo, you're flipping that coin and saying, and they're the ones who are then going to be making the arguments and overhearing themselves, saying like, this is why I need to make this change, and why it's aligned with my values, my own particular values. Okay, so let's see. The principles of. I'm going to go ahead and I'll pause for questions in one or two slides here, because I want to get through this part. This is kind of the overview of the principles of motivational interviewing, and then I'm going to go in and talk more particularly about these different principles. But the four overriding ideas are, and this is also kind of like in order of how you would work with MI with young people. The first one is expressing empathy, so accepting their beliefs and behaviors, not the same as agreeing with them, but just accepting that this is where they're at, meeting them when they're at, and also the expressing empathy phase is a important rapport building phase also of showing consideration and respect for their thoughts and beliefs. And then the second part, developing discrepancy, we're probably going to spend the most time on that one because it's recognizing inconsistencies between the current behavior and their life goals or values. So developing discrepancy is kind of the most like active phase of MI. Like it's like kind of the most change. It's the most changing phase of the treatment or of the approach. And then also rolling with resistance kind of goes along with that of like rather it's like a different way to kind of deal with like quote unquote resistance is like reconceptualizing what resistance to change is and then finding ways to kind of sidestep that and move around creatively around the resistance rather than confronting it head on. And then finally, supporting self-efficacy for the young person and expressing optimism, helping them identify a range of effective alternatives for achieving their goals. So those are kind of the four levels. And some of the techniques, and I'll say a little bit more about these as we go on, are reflective listening with a warm, non-judgmental restatements and clarifications. Open-ended questions. Can you tell me more about this? What do you think about this? And then affirmations. I really respect your honesty with me about this stuff. And again, we'll go into more kind of like what that looks like with affirmations. And then summaries is a part of MI2. It's like periodically providing those, the counselor, the person who's doing the MI with a student, with a young person is like, providing these summaries that can kind of draw things together and help the young person to kind of frame what this conversation is about and like what the takeaway is going to be. Any questions right now as we go forward? I know I'm just sort of painting the broad picture, but anything? Okay. All right. So we're going to get into a little bit more of the details now. So expressing empathy, accepting, again, that the adolescent's beliefs and behavior is not the same as agreeing with them. I mentioned that a minute ago. And a non-judgmental environment that allows them to talk openly and communicates understanding. You know, one of the things we talk about I work at David Douglas High School in their student health center. So not in the school, but like the Multnomah County Student Health Center. And one of the things we talk about a lot amongst the staff and like is confidentiality. You know, we try to kind of present the concept of confidentiality to the young people in a kind of nuanced way in the sense of like, you do have quite a bit of confidentiality when you're here. You're not, the things that you're talking about are going to not be just, we're not just going to pick up the phone and start telling your parents all about what you just said at all. And at the same time, because parents have access to notes, they can see some information on there. And then, of course, when there's risk issues, that's a reason why we would break confidentiality. So, but I just bring that up because it's, I think, being able to be open about those rules around confidentiality and like helps them ultimately to talk more openly because then they understand where they stand with what they can feel comfortable sharing. And then waiting, kind of compartmentalizing the concerns that you have. So not getting rid of them, but just compartmentalizing the real and sometimes very urgent concerns that you have about a young person's substance use, for example, and resisting the urge to just right off the bat give alternative points of view until more of that rapport building has happened, until you feel like they've given their permission for you to share some other ideas with them. Okay, so I mentioned affirmations earlier, and affirmations are something that can be, if they're accurate and specific to the person, can be a really powerful way of both building rapport and promoting self-efficacy and optimism in the young person that we're working with. So they usually don't start with I, but like instead are centered on you, and they provide accurate empathy. Accurate empathy is a concept that Carl Rogers talked about, who's one of like the founders of counseling, and he talked about like there's a difference between just kind of general empathy of like, oh, I'm sorry, or, that's hard, and that's okay. It's okay to just sort of make generally empathy statements at times, but it really hits more powerfully for people when it can be like an accurate empathy. Like you really, not only do you empathize with them, but you understand kind of more specifically like where they're at and like what it is specifically that they are struggling with. And so I just provided a few examples, like even though it didn't turn out as you hoped, you made a tremendous effort. And even these are kind of like more general because it's not a specific person, but so, and you're a very courageous person, and that these are genuine, it would feel false for if a counselor doesn't feel like this about a student, or a young person, like, you don't have to say it. It's just, but usually there's some kind of affirmation that you can provide them, even if it's not that they've been succeeding a lot. It's like calling out the effort that they're making, calling out the patience they're showing, or the honesty that they're bringing into the interactions. So just finding that thing that you really genuinely have noticed about that young person, and then calling that out with these affirmations. And you showed a lot of patience in the way you handled that situation. Even though you're going through a lot, I can see you're working hard to keep a hopeful perspective. So affirmations are a part that can come anytime during when you're using MI with young people, but especially in those early phases, because it's like you're building that rapport with them. Okay. I just mentioned some challenges in this early stage, which is, managing pressing urgent risk issues, and that's something that it's hard to get into a lot of detail about because, we don't know what those risk issues would be, but, if related to their use but I guess what I would say about that is that I don't think it's not, it doesn't conflict with coming from a motivational interviewing perspective to also deal with risk issues. It can be something that can be handled along the way with honesty and candor with the young person, and even though sometimes risk, oftentimes, such as making safety plans that involve taking certain things away from medications or knives or whatever it is. If there's a suicide, this is in a situation of a suicidal young person, then those are in a sense things that are taking away their choices in a certain way. So you could see that as taking away their power in a certain situation. But I feel like there's a way to kind of present to present that in a way that's still consistent with motivational interviewing, in the sense of that it would come back to values, even though we're taking these particular choices away from you of making these destructive choices, then it's still how is this kind of getting to promoting something that's important to you, your family or your, we're still aligning with you on your values, I guess is what I mean. Kind of bringing it around to we are together on what you value. We want to help, we want to work with you on what you value and what your goals are. So something along those lines. And then this is also more what we as counselors, as professionals, people working with young people, bring into the room. Often we have faced repeated disappointments in the past with other clients' choices, and worked hard in situations only to have a client take a big step backward and or make really destructive choices. And so this is more of just, I guess, a professional self-care perspective to take of processing those experiences, making sure that we have a venue in our lives, whether it's with a supervisor or in a consultation group or something, to process those experiences, because otherwise, we can repeat those kind of repeated disappointments. We can kind of bring that into the room with a new young person, and it allows us, or it makes it difficult for us to come from that place of genuine acceptance and empathy for that young person, because we maybe have this cynical edge to our thoughts, or our we come with these presuppositions, or we might have like counter transference from like, oh, this young person reminds me of this other young person, and I had this like really negative or difficult relationship with this other person, and then so you kind of project that onto the new young person or whatever. So all those things are just something for us, like in order for MI to be effective, we have to be able to come into the room and able to accept and give empathy in the ways that's needed for this approach to work. So I just wanted to put that out there. Let's see. Okay, so that was the expressing empathy part. Now I'm going to go into the developing discrepancy part. So this is, again, the kind of the most active phase of motivational interviewing. And I think it's really interesting. And this is where motivational interviewing really kind of becomes more unique than other treatments that might just kind of be acceptance-based, like empathy. A lot of those can be things that are part of other approaches as well, but this is where MI really distinguishes itself. So it's directing. So it's directive in the sense of like, it's not just kind of letting whatever comes up in the moment and just responding to that. It's kind of guiding the young person in a particular way to recognize the inconsistencies between, in this case, their substance use or their other destructive behaviors and the goals or values that they have. So we know from cognitive or from social psychology and other things that like discrepancy is another way to say like cognitive distortion, which means like when you have two ideas in your head that are not compatible, it's uncomfortable, mentally and emotionally it's uncomfortable. And so a person wants to resolve that discrepancy in whatever way, and sometimes it's not in good ways of like, if you like, sometimes it's in ways of like dismissing valid concerns and stuff and whatever. So but in this case, we're kind of using, MI kind of leans into that idea of like that having these discrepancies, these in your mind is uncomfortable, and so it's using that discomfort in a way to leaning into that to then push in a positive way towards a young person resolving the discrepancy in a way that helps them to choose a healthy behavior. And so some of the techniques are reflections and the importance and confidence rulers. So I'm going to talk about the importance and confidence rulers first, because I have this neat slide about it. That Katie actually found. So credit goes to her for this. But so we often employ 0 to 10 scales for a lot of different things in our work. Can you tell me 0 to 10, like how anxious you're feeling today? Or, and we might even say like 0 to 10, like how confident are you that you can make this change? And so those are common, but the way that MI uses this is you do that. So I'll start with importance. So there's importance and confidence, and they're not the same thing. So let's just start with importance. Like how important is, so you might be asking a young person, how important is it to you to reduce your marijuana use? If it's something, let's say it's a young person who's been identified in one way or another as having really marijuana use that's really affecting their school, their life in different ways. I'm just using that as an example. Then you could say like, how important is it to you to reduce your use or stop using? And they might say like how important if they're at a stage of change that like they're not really thinking about it that much, they don't really see it as a problem. It's other people that see it as a problem. They might say like importance is like really little, like 1 or 0, how important it is to me. It's not important to me, it's important to other people. And then their confidence might be like really high, like, like it's like 9 or 10. I could just like stop. I could cut down using whenever I want, which may not be actually true, but that's how they feel. And so that's how it's kind of the difference between importance and confidence. And but let's say that the young person on the importance ruler says, they're pretty much like sure that this is not a problem. Other people think it is, but they don't think it is. And like, so, they say like 2. And you're like, maybe 2. And so instead of being like, oh, well, you know what? Like a traditional approach would be like, how can we get you to a 10? Like, let's get you that 10. We want to, the health coaching kind of thing of like 2, like what? Like, this is really important. Like you got to get there, and, but instead of that, which is largely ineffective, you flip it and you say, and you would ask the young person like, well, okay, so 2. All right. So why not 0? Like, what is that 2 about? Why are you a 2 instead of a 0? Like, and then pretty much whatever they say at that point, whatever they respond is going to be change talk, in the sense of like they're going to be then in that moment voicing a reason for them to make a healthy behavior change, and they'll be like, well, I mean, it's totally not a big deal. Like it's fine. It doesn't affect my life at all. But, it is like causes a lot of conflict with my family or something, or, like my parents know that I smoke a lot and like they are always mad at me about it or whatever. So like maybe that's the reason that they express of like why they're at a 2. So that's a first step of recognizing that like maybe a value for them is having good relationships with their family members and not having a lot of conflict in their relationships with their parents, for example. And so then that would be something that's like a beginning of a conversation that could happen. And then the confidence is kind of similar, where it's like, let's say it's somebody who is not confident, let's say like, I keep using the marijuana example. I'll just use it for this one as well, but obviously it could be other things as well. But let's say that they're like, I don't know, I've been using for years since I was like 9 or 10, which is not that uncommon. I don't know, this has been a part of my life for all these years. I don't know how it would be, not getting high and, or not, or I don't even get high anymore. I just use it, and then, so I'm not that confident. I'm like a 3, on confidence. And then similarly, you could say like, okay, well, yeah, thank you for sharing that. That makes sense that like, it's been with a part of your life for all these years. Like, then, so like, why not a 0? Like, what is that part of you that feels like there is a little bit of, maybe hopefulness or possibility that you could make a change, and then they could speak from that place of like building self-efficacy in that way. So any questions about any of those things?
Could you just state what the question is around the confidence ruler that you're asking? What question are you asking?
Mm-hmm. So what question?
I see the important one on there.
Yeah. So that's the important one. So how confident are you that that you could make this change? How confident, do you feel like you could, that this could happen for you? And again, this gets back to like the roots of motivational interviewing with problem drinking, as it was called back then. And like, how confident are you that you could reduce your drinking, quit drinking, or whatever. And people might say like, oh, I'm not confident at all. And then, but maybe a little bit. And then, so it's how confident are you, that you can make this change?
Sorry, this is late, but an affirmation that I like to share, especially, a lot of our kids have got a lot of guilt, shame, feeling bad. I like to say, just because you feel like shit does not mean you are a piece of shit, of course, depending on the age. Or if you feel bad doesn't mean that you are bad. That's really helpful for people to hear too. Yeah.
Thank you for sharing that. That's a great affirmation. Yeah. There's some really powerful affirmations that I think especially once a relationship has been built with the youth, the affirmations, like if you're right out of the gate with an affirmation, it might feel a little like, well, you don't even know me, you don't even know my life. But like once you have that relationship built, then I feel like that's a wonderful affirmation to share. That could really hit for that young person. Thank you. Okay, so reflections. So reflections are the key technique of motivational interviewing. And so they're directive interventions that intended to move the youth toward behavior change by allowing them to overhear their own conflicting thoughts and feelings. Again, keeping this idea of like ambivalence and conflict like mental and emotional conflict that they have, and leveraging that conflict, that discrepancy that exists in their mind. And so these are the different types: simple reflections, reflections of meaning and feeling, double-sided reflections, and amplified reflections. And I'm going to go through and talk about these. Let's see. Simple reflections. I told myself I wasn't going to tell this story, but I'll just say it real quick. But like one time I was with my friend in LA, and he was like, "Oh, let's go to the Cheesecake Factory." And I was like, "Okay." I've never been to the Cheesecake Factory, but I was like, "Yeah, like cheesecake, like I like cheesecake." Like, yeah. And then, so we had our dinner, and then afterwards it was like, I was like, "Well, let's get some cheesecake at the Cheesecake Factory." And then the waiter came out, and he was like telling us all about like the pina colada cheesecake and like all these different subtypes of cheesecake that they had. And I was like, well, and afterwards I was like, "Oh yeah, thank you for telling us about that. But I think I just want the classic. Like I just, just the cheesecake, just the plain old, and he was like, you could just see his face drop. He was like, so just like the basic cheesecake." Basically, like in his mind, he's like, "I offered you the pina colada. Like I offered you all this, and all you want is a basic one." I was like, and then after, he kind of like walked away. I was like, "Oh, geez, I guess I shouldn't have just asked for the basic cheesecake." Like that was a real moment with that guy. Anyway, so yes, so dumb story. But I always think about when it's like a simple reflection. It's like, it's still good. It's still helpful. The simple reflections, even though it's not the pina colada, still helpful. So simple reflections, they convey basic understanding. So this is like, especially early on, you help the flow of the interaction with the young person, them feeling heard and empathized with, but it's not really adding any new information. You really are just kind of restating what they're saying in different words, but still the helpfulness of it is that it helps them to feel like, yeah, this person hears me, they're getting what I'm saying. And so they have to say, so this is like, say it's like a young person in some sort of treatment program. They say, "I have to do this treatment, but I don't need any of this." And then the reflection would be like, you don't feel like you need this kind of help, So again, you're not like doing anything else fancy when you're a reflection. You're just kind of letting them know, like, where they're coming from. Okay. And so then this one these are really important. Reflections of meaning or feeling. And basically it's like you're still reflecting back to them what they're saying, but you're kind of reflecting back the implied or the underlying thought or feeling of what they're saying. You're not sticking as closely to their words exactly. You're reflecting back, like, I hear what you're saying kind of on a deeper level. Like, this is what I hear you saying in terms of what your feelings are about this situation. So the teen, this is bullshit. There are tons of kids in my grade who drink way more than I do. And the reflection is, it makes you angry that people think you have a drinking problem. So it's kind of like reflecting. In this case, it's not a big jump. Like, you can tell that the young person is angry. You can tell that they feel kind of unfairly targeted for criticism when, like, so many other people do the same thing as them. There's this sense of injustice and unfairness. So you're kind of, you get that from what they're saying, and then you just reflect that back to them. Like, I hear where you're coming from with that. I hear your feeling that even though they didn't say I'm angry, it was clear from what they were saying. Actually, let me pause on this for just a second. Because there's some evidence that shows, like, especially with younger people, the younger the developmental age, the more reflecting their feeling is helpful, because it's like capturing their emotion in that moment. I wish I had more examples here on here, because it's helpful, but is more helpful than maybe their kind of more like cognitive meaning of what they're saying, but like their feeling. But again, it's kind of like you're not adding, well, you kind of are adding some new stuff in there, because you're trying to encapsulate in your words, like what they've said, what they're intending to say. And you're making them feel heard. And you're also checking for meaning. Maybe you might be off base, you might be like, this is not a good example, but they might be like, "No, I'm not angry. Like, I'm not angry. I'm just frustrated because of this," or something. Or they may have some response of like, "Okay, yeah, thank you. Well, now I understand what your feelings are a little bit more." And But the reason that it's helpful to do this meaning and feeling is because you're starting the process of reflecting back to them what your aim is still on that idea of discrepancy of like, so you're feeling angry or that and kind of unfairly singled out because as having a drinking problem, and then whereas other people are not, and so then that kind of, then they're like, yes, that is how I feel. And then and so it's like, you can see how it's kind of a step, and then you take the next step towards like, you might, and I'll get to this in a minute, but like you might then, the next step might be like, okay, well, so basically like you feel like there's not, like you don't have this issue, you're not like, it doesn't affect your life. You're drinking, like taking the other people out of it, like your particular drinking pattern doesn't really affect your life at all. And they'd be like, yeah, well, not much. I mean, barely at all, and then you can start like, okay, well, yeah. So what about the little part though that does, like, how is it affecting your life? And you can see this is kind of like a stage you're clarifying, and then you're going to move forward from here. So double-sided reflections are a very powerful intervention in motivational interviewing. And this is when, so before they're just expressing their feelings, then now they've actually expressed both sides of ambivalence, or some sort of ambivalence about their substance use, expressing the no change side, like as in like there's no need to change, and the change side. And so they might say, sometimes I get mad at myself for spending so much time getting high, but I don't do it during school, so I know I can control it. So they're kind of like, in what they're saying, you already can hear the ambivalence of like, this is not a big deal, it's not a problem. Other people are making it more of a problem than I am, and I can control it. But at the same time, I do get mad at myself sometimes. I do feel some frustration with myself. So that ambivalence is inherent in what they say. So then the reflection is just kind of bringing that into a sharper relief. Like, you don't believe you're addicted to weed. At the same time, it bothers you that you spend so much of your time getting high. So it's kind of just clarifying. So this is what I'm hearing you say, this and this. So there's this discrepancy in your life, in what you're feeling. And those kind of, this and then this also, double-sided reflections are really kind of a real hinge that a lot of the motivational interviewing turns on, is like, really now the discrepancy has been pointed out overtly, and now the young person is aware of it fully in their own mind. And then the amplified reflections are not always used. I'll just say this, they're not right for every situation. It's not like you're always going to go to an amplified reflection, because they're a little bit more of even more kind of directive, or a little bit more pushing the envelope slightly. And so it can be really perfect in some situations. In other situations, you probably wouldn't want to use this. But so typically when the adolescent has expressed a strong no change message, like when you feel that there's ambivalence there, but they're also kind of like being really guarded and kind of retreating back into like, no, this is like, I don't feel the need for a change. So it would be to exaggerate or intensify what the adolescent said, to lead them to disavow or correct the distortion. It's like, my mom exaggerates so much about how much I smoke. And the reflection be like, it seems to you she has no reason to feel concerned about you. And then so you can see how it's like jumped a little bit ahead of what they said, kind of amplified, like, they didn't say they have no reason, but you said that. And then the idea is then whatever they say after that, they'll be like, well, then they're going to like backpedal a little bit, but like, well, no, like, I didn't say she has no reason for concern. I can see how maybe she has like a little reason for concern because of this. And that's change talk. Now you've engaged them in talking about the consequences, a negative consequence of their substance use. Okay. So rolling with resistance is a concept that is kind of, it's part of the idea of like not of joining with them, of trying to be on the same page in terms of their values and their goals. And it's resistance usually. So, and also just like the idea of like resistance is not a helpful concept in general, like the idea of like somebody's being resistant, because even though you may feel like that as a provider or somebody who's working with them, it's not, to conceptualize it in that way becomes like a block. It becomes like a mental block for the person who's trying to work with that young person. You become mentally blocked as well, because you're like, they need to do this. This is where we need to go, and they're pushing back and resisting. And so that's like even though again, there's emotional truth to that it's natural to feel that way. And at the same time, it's not a helpful way to conceptualize it. So when an adolescent feels pushed to do something they're not yet ready to do, they can be overtly resistant, or they can be the signs that they're not ready, that they're being pushed in a direction that they're not ready to go in yet. They're arguing, denying the problem, missing appointments, or covert. This is important to note also, covert resistance, or covertly, like they're like, oh yeah, totally, I'm going to do that. Yeah, like, oh, 100%, I'm going home right now, and like, this is it. I'm never touching that again, and this is, you've changed my life. Thank you. And then you're like, oh, well, yes, I did. You're right. And so it's covert resistance is important to be aware of. And then it's better to reconceptualize it within the stages of change model. So, I like this slide on or this version of the stage of change model, because it's I'm actually going to use my laser pointer. I don't usually have one of these, so this is a new thing for me. Ian was joking, like, are you ready for this level of responsibility and power? And like, with great power comes great responsibility of this laser pointer. Very quick, because most of you know this model already, but just if a young person is in pre-contemplation, they're very much in the stage of like not recognizing a problem at all. They might barely start to recognize some problems with their use, but they are not in any kind of mode of being ready to make a change. Then they're thinking about it, and they recognize more. This is sort of where I would say a lot of motivational interviewing happens. It helps. It's like moving them from pre-contemplation to contemplation, and then from contemplation to preparation. And then once they're in like the action or maintenance phase, like the motivational interviewing it's more just like self-efficacy, just supporting them. But in terms of actually like moving them cognitively and emotionally, helping them to move into the contemplation, that's where like MI really works, is the most kind of geared for these areas. And so resistance is better conceptualized as just that they're not there yet. They're not, you're trying to do an action intervention with a young person who's at pre-contemplation. You're trying to skip these steps, and that's why there's quote unquote resistance. It's because they're not there yet. You have to. It's there's not a at least for this young person, like there's not a shortcut. You have to go from stage to stage, and so and using MI, you have to carefully work with them, establishing that relationship, developing the discrepancies in their mind, talking about values and goals, and having them voice change talk of why it's important to make this behavior change gradually, to bring them gradually from pre-contemplation to contemplation, then gradually into preparation, and then they're kind of ready. And the reason I like this is because it's like when there's relapse, it's like you could either go, it's like, instead of just being like up and then you go back, into the circle, you who knows, somebody might relapse and then just go right back to the pre-contemplation or contemplation, or just they might be ready to just go straight back into preparation. So I just like that kind of idea of like when a relapse happens, for different individuals, it puts them back at these different stages of change. Supporting self-efficacy, which I said before, is just after rapport has been established, you've asked their permission, you've gotten their buy-in for suggesting alternatives to what they're currently doing, and then you're expressing optimism about their change isn't all or nothing, and you're talking about learning opportunities, using a lot of affirmations. Challenges. I won't spend a lot of time on here. I feel like this slide is kind of like at the end of like an ad for like a medication, where it's like, this medication may not work if warning signs if they may cause side effects, or like this medication won't work if you have this, it's like this block of text like don't use motivational interviewing if the following are happening. Oh no, whoops. There you go. But it's worth mentioning that there, like any other intervention, there are some limitations or things just to be aware of. Like for somebody who is struggling, maybe whether it's from a developmental disability or some people struggle to be psychologically minded and self-aware of their thoughts and feelings more than others, and sometimes that can be learned and taught. So it's not that but it's if you are working with a young person who just really, it's something for them is like it's really a struggle just to have a basic level of kind of thinking about their own thoughts or being self-aware, then you might just need to go really slow or recognize that will be something that maybe you might want to wait on using MI for that young person, because they do need to have that ability of seeing those differences. Here's what my goals and my hopes and my values are, and here's what I'm doing, and that's in conflict with that. So they at least need to be able to kind of understand that kind of idea, and then. Just developmental changes, influence of peers. I mean, all these things, none of these things are like, you shouldn't use motivational interviewing, but I feel like motivational interviewing also is good because even if it's like reluctance to seek help, you can do like a little bit of rapport building and then like maybe pose a reflection or a question, just one of those like double-sided reflections. You spend, if you have 30 minutes with a young person, you spend like 20 minutes of it like developing that rapport, helping them to feel heard, and then you just might pose like one double-sided reflection with them. Like, well, I hear you saying this and that makes sense, and I also hear you saying that like, it's causing this problem, or like it makes you feel frustrated with yourself when you do this. Does that sound right? And then they're like, yeah. And then that could be it. That could be the intervention. Then they can go off and they can have that percolating for them. So that's how motivational interviewing can be like a more brief treatment. Oh, that's it. There's my references and then questions. So I think that's good. All right. Yes, go ahead.
Amazing stuff, first of all. This goes back to the beginning. You were talking about confidentiality and risk, and I'm used to working with adults, so this is new. And so in my head, someone using drugs is not a behavior where I'd need to call someone, right, or tell someone. And I feel like it's 15 and up can consent to treatment. So I guess, and this is obviously a bigger question, but when is it that we do need to involve caregivers or parents? Like, it's a big question. I know, like for me, I'm just like, okay, well, suicidality, homicidality, like things like that, obviously we need to report that. But if kids are using drugs, like, I mean, it's risky, obviously it's scary, but that's not something we need to report, correct?
Well, it depends on whether this is new information the first time that you are hearing of it, or if this young person may have already been coming to the center for a while, and it may be documented that the family already knows about their use. And then also, of course, the extremity of the use, like the pattern of how risky their use is. And so it's like, I mean, as a general rule, substance use is definitely one of those things you would like break confidentiality to share with the parents. The only, I guess, not really an exception, but just is if you know for a fact and it's documented the parents already know about that and there hasn't been like a change in the pattern of use, you may not need to like write in that appointment, update them because you already know. But it's also, part of treatment to bring the parents into treatment at some point that, unless there's a issue of harm that would cause, but that's unusual, but to bring the parents into the treatment process at some point. So if it's something that's like already a known thing that you're working with them on, then the parents can be brought in and notified. Well, they've already been notified, then you can wait. But if it's like this is the first time you're hearing about it, and it's also something, and just in general, I would say like the parents would want to know if this is the first time it's coming up. But that can come with a pre-conversation with this student, where hopefully you would have already put that out there, so it's not like going to catch them off guard that you are going to need to share it with their parents, and you can have a conversation with them before calling the parents or before having the parents come in to the room, that like this is how, ideally the youth would be the one sharing it with their parents, not the counselor. And so they could put it in whatever terms that they want. But then, so yeah, I don't know. That hopefully that answers your question. Yeah.
So for the person who is doing the motivational interviewing, what do you suggest? Because like active listening is definitely a core skill of that. What do you suggest for the interviewer, any kind of like strategies or tools that they can be using on a regular basis to help strengthen the active listening piece?
I guess I would just say to focus on the reflections, the different reflections, and the simple versus the meaning or emotional reflections, and then sometimes the double-sided reflections, just focusing on using those. And so it's like the active listening, if you only ever use simple reflections, it would the interaction would have kind of like a circular feel to it, because it's just like, yeah, that is what I said. So you said that. Yep, that's what I said. Like, okay, so I hear you saying this. Right, that's what I said. Like, and so like, that's why you need to like, so I would just say like to maybe continue to think about those meaning and emotion reflections, and then also the double-sided. That's where you kind of like help the person to like move things forward in their own thinking and their own conceptualizing of their problem, what's going on for them.
Thank you.
Mm-hmm.
There's a podcast, so I've been trained in MI, but it's hard unless you're continually, you're always reviewing the skills and practicing. So there is a podcast that I think is helpful for me, Talking to Change. And I think it's an old podcast. I don't think they're recording it anymore, but they give you a lot of guidance. And also, in the group that I do for 4D Youth Center, I teach parents motivational interviewing with their kids as well. So,
oh, that's great.
Support group.
Thank you so much for sharing that. I have a lot of regard for the 4D services. I've referred people a lot, and so thank you so much for sharing those. That's somebody actually earlier before my presentation was asking, like, is there like some sort of a group or some sort of like way to continue to hone, the MI skills? So thank you so much. Okay. Yeah.